Welcome to Ordinary People Doing Extraordinary Things, the podcast show. I'm your host, Carrie Roberts, and today's interview is part of our expert series. And joining me today is clinical licensed social worker and certified clinical trauma professional, Priscilla John. Welcome, Priscilla. Thank you so much for being here.
For having me.
So we are chatting today about resiliency in children and adults. And before we kind of get into that, what I first would love for you to share is, how do you define resiliency?
Resiliency can basically be defined as the ability to bounce back from adversity, the ability to tap into your coping mechanisms when being faced with stressors or experiences that kind of exceed what you're able to cope with or what you're able to deal with at that time frame.
And is resiliency something that people are born with? Like, do some people have more of it than others, or is it a 100% learned trait?
Interesting that you asked that question because there's a lot of research regarding resiliency. You see that some people go through traumatic experiences, two people may go through the same exact experience, probably in the same household, and they may have two different outcomes in terms of resiliency. So, a lot of the research shows that when you experience a traumatic event or you experience any type of event that exceeds your ability to cope, that there's some risk factors that are associated for outcomes as the person gets older. So, in terms of resiliency, some people may naturally be able to have more resilience than others, whereas someone else may need additional support, whether that support be through therapy or talking to someone or whatever it is. They don't have the same coping mechanism, so their resiliency levels are not the same.
That's interesting. So it is kind of a mix of it. And I know that your specialty is a little bit more in kind of children and adolescents. And so I'd love to touch on that first before we get into the adult side. Can you talk a little bit about how children tend to handle stress?
Handle stress a little bit differently than adults do. So, as we know, it's a different developmental level, and it really depends on what age that child is. So, if we're talking about children that are below 5 years old, it's a different way of handling stress. And children that are, right before that level of adolescence, that's also a different level of handling the stress. And then, of course, teenagers handle it differently. So, children that are below 5, they may have temper tantrums, they may have complaints, and this may pertain to children in between 5 and 12 years old as well, because those symptoms and the stress can be manifested within the body. So, you may find children complaining of body aches, they may not be able to regulate their emotions. So, you'll see the temper tantrums and the screaming, and that's just basically them kind of, asking for help, but not knowing how to do it in, the way that an adult would do it. And that usually happens just based on their developmental level.
And, one of the things that I found really interesting when we connected is that you're a dancer like myself. And part of what you do to kind of help kids specifically kind of find their own resilience is through movement. You were just saying when we're stressed out, we feel it in our body. Can you talk a little bit about like that kind of mind body connection and how movement or dance or any type of movement really helps with children specifically in stress?
Mind body connection is really important when we're talking about trauma and resilience. And even Bessel van der Kolk, he's a leader in the field of trauma research. He's a psychiatrist, and he talks about that in his book, The Body Keeps the Score, and just how much our body is involved in trauma and how much we need to involve the body when we're talking about the treatment aspect. So definitely, of course, because I'm a dancer, I was attracted to using movement and dance. But upon doing research, I also do research. I noticed there's a lot of literature out there that supports the use of movement for building resiliency. Bessel van der Kolk, he also put out some research recently, him and his colleagues, where they looked at the use of yoga and also looked at the prescription of medication among women who were experiencing post traumatic stress disorder. And they found that yoga was a much more beneficial option for reducing those traumatic stress conditions. And the reason for that is because that trauma is stored within the body. So even when someone may have experienced trauma within their childhood and they try to put it behind them and avoid those symptoms, which is a common symptom associated with traumatic stress, it's still there within the body. It's there within the way that they express themselves, the way that they communicate with others, the messages that they send to themselves as well as to other people. So it remains present in the body. And to really treat it, you kind of have to use some mind body based approaches, which is why I enjoy doing those approaches with my clients because I work primarily with individuals who are exposed to or dealing with complex or prolonged trauma.
We have a question right here I'd like to answer first. L. Anthony Roberts Jr. says, are there restrictions due to COVID-19 where schools are mostly virtual? Is this adding more mental, emotional stress to our young adults?
Absolutely is adding more stress. You know, of course, there's no articles that are out as yet that's, like there's no longitudinal studies or there's no like long-term studies that's showing this, but there are a lot of articles and there are a lot of researchers that are talking about the fact that the need for mental health and psychosocial support has significantly risen in these times. And it's not just for children, it's for children, adults, everyone. We're all adjusting. And this is what happens when we're exposed to trauma or changes in the environment that you didn't really anticipate. You know, our nervous system is always looking for a sense of safety and a sense of knowing what's going on. And when faced with novel situations, like we've never experienced this situation before. So it definitely is something that can affect the emotional state of children as they, go through their journey, their academic journey in school, and adults as well.
Yeah, I think, like you said, during this, as we're recording this, December 2020, it's been a crazy year. I think that's an overused term, but you have not only the stress of, well, what if I get sick? Or if people do get sick and people pass away, or, now I've got to do school at home and I can't see my friends and understanding that. And maybe there's stuff at home. There's so much going on. And, again, I want to focus on the kid part first. What are some ways, that parents or teachers, again, because teachers are now only seeing them through the screen primarily, some schools are still in person. What are some things that they can do to help build resilient kids in this time of craziness that we're feeling, let alone what they're probably feeling at home? Can you maybe give some suggestions that parents or teachers could do?
Definitely starting off with tapping into the strengths of the children because a lot of the times we focus on the weaknesses and parents may come in and they're like, well, my child isn't doing this, this, and this. And we tend to not focus on that child's strengths. So every child has a strength and it's all about tapping into that particular strength to help and encourage them to build the areas that they're having weakness in. Like a lot of children, they're not used to sitting at a screen all day. A lot of adults are
Yeah.
not used to doing that either. So, we're all adapting and adjusting. And like I said, we all do this differently. Some people are able to adapt a little quicker than others, whereas some people need a little bit more guidance, a little bit more help. So for children, I would definitely recommend some um, behavioral strategies. And parents can do this. You don't necessarily have to go to a therapist, but it's always helpful to have the support of a therapist. But there's something called token economy. So using reinforcement when children do what they're supposed to do, reinforcing them. And it doesn't have to necessarily be something physical like a gift, but it could be praise. A lot of children love attention. So just kind of Good job. Like, thank you for doing that. Or you did such a great job. Like, children feel great hearing those things, even though, it may seem like it's not as significant, but it makes a big difference. And, it could even be a system of collecting points, and then those points can be traded in for a gift or money or something like that. So, definitely using behavioral strategies with children is really effective. And it works with adults as well, but of course in a different way.
And for the kids, I mean, you were talking too about kind of the movement thing. Again, not everyone knows how to teach dance or yoga, but are there some movement things that maybe teachers or parents could be doing with their kids, especially in areas, where it's getting cold and you can't be outside because of weather and that sort of thing? Any type of movement patterns or things that you suggest?
Yeah, movement, like I said, it really helps with fostering resilience. And if it doesn't necessarily have to be in that therapeutic space, but it could just be playing music in the house and having the children move. There's also yoga classes for children that teaches them different postures. There is a professional by the name of Lisa Flynn, and she has developed this program called Yoga for Classrooms. And she has been teaching teachers and educators as well as parents how to implement yoga within, and you don't have to be a trained yoga instructor to do this, but how to implement, some of the postures in yoga and how children can associate that with different states of feeling. So, like feeling strong and mountain pose and all of the different poses that kind of come in. It's really cool. And children just love moving and doing those things anyway. So for them, it's right up their alley.
For some of the older kids, I guess I'm going to speak about teenagers. I think, even before COVID, one of the challenges for teens nowadays is everything is about social media, about does someone like them? Are they getting enough likes? Are they getting enough hits? What is somebody saying about them? All these things that definitely were not around when I was a kid, which I'm very grateful for, but they're here now. How do you teach, again, these kind of 13 to 17-year-olds that are using social media? How do they do it in a way that is fun and productive and that they enjoy, but also allows them to build confidence and be resilient without being kind of hurt by some of these things that go on?
Question. I actually, earlier this year before COVID, I was at a high school talking to teenagers about this, and the concept of social media did come up, and I know it rules lives for many people. Like, it's like the first thing you do when you get up, the last thing that you're doing when you go to sleep. But it's really not healthy to have that way of kind of navigating your life. And with my teenagers, I kind of encourage them to develop healthy patterns, healthy routines, and rituals that they can incorporate into their lives. So I'm a firm believer in the way that you start your day is going to affect the outcome of that day, as well as whatever you're taking in right before you go to sleep. That's going to sit in your unconscious and affect you in ways that you may not even know that it's affecting you. And to touch on what you mentioned about, the likes and not getting likes versus getting likes, and what people are saying in the comments and how that affects teens. I think that's major, especially because at that time in their development, for some teenagers, they really do feel like they know everything. But obviously, there's like a whole world that they have not uncovered as yet. So they are more vulnerable to the effects of criticism and, you know, whatever people feel about them, and the idea of whether or not people like them. So I think it's really important for them to kind of take a break from social media sometimes, know that it's okay to take a break, and definitely dedicate time towards their self through mindfulness or through whatever it is that works for them, where they can connect with themselves. Because I think for teenagers, it's all about connecting with, their friends and what society says, but there's no time that is being used to connect with themselves. So I think just taking that moment to yourself, whether it's through journaling, whether it's through mindfulness, whether it's exercising, which also includes movement, whether it's dancing, whatever the hobbies are, those things are important to tap into.
Yeah, I've taught dance for a while as well, and I've noticed recently I have a lot of like 8 to 10 year olds, and sometimes before COVID, parents have overscheduled the kids and they'll act out, and I know they're just tired. I think people forget like kids get tired too, and they need a break too, and need to learn how to play as well, right?
Yeah, and I think that what you said is really true. Like a lot of adults and a lot of parents tend to think that children can't be stressed. Like all they have to do is go to school and they don't have to pay any bills, which is great. It's good to have that feeling of not having the responsibilities of being an adult. But at the same time, children go through stress just as much as adults do. And you really need to acknowledge that. Parents need to listen to their children when they're talking about whatever experiences that they have and take it seriously, because obviously for us as adults we may like dismiss some things or not take it as serious because we feel like, oh, like that's no big deal. But of course for the teenager and the adolescent, that is a huge deal. Like so definitely just listening to your children and giving them that space, because that helps to build their confidence. And when you have situations where a parent may not be necessarily tuning into what their child has to say, it damages their self-esteem and their sense of self.
Yeah, and you were saying earlier that a lot of times kids will kind of showcase stress in an outward type of way. But sometimes I've seen where kids get really quiet because a parent has told them, not to show emotion or to just deal with it, or there's maybe abuse or things happening. In those situations, if you're maybe like an outsider noticing this, is there anything you can do? I mean, or can you help them in their dance class or baseball camp or something to kind of get through that, be resilient? Is there anything they can do to kind of help them so they're not having that trauma later in life, or not really?
Always something that you can do. Like as human beings, we are in a constant state of evolution. Who we were last year is completely different than who we are in the present moment. And of course, in the future, there's always room for change, growth, and development. And with teenagers, they haven't reached their maximum. I mean, no one ever really reaches their maximum level of development. So with teenagers, you make a great point, because there are a lot of cases where children internalize those feelings of anxiety, trauma, whatever it is that they experience. And instead of showing it in an outward and overt way, they kind of hold that within. So, with children like that, first of all, the individual that's interacting with them has to have that awareness. Sometimes some people may miss things like that and may interpret it as maybe someone's just being shy. So, you really have to have that awareness. And like I always say, I'm all about a strengths perspective. So figuring out what that individual, that student's strength is, and kind of using that to build a relationship with them if there isn't one. Because teenagers, they're not necessarily going to tell everyone everything. So you have to have that rapport and that relationship where they even feel comfortable before you try to intervene or try to do something. So once that relationship is established, just kind of, they may actually come out and say something if they feel comfortable enough. But sometimes just asking those questions, is everything okay? What's going on? And just focusing on their strengths as opposed to the weakness, because it's definitely going to help with building the rapport. And with building the rapport, they may come forward with what's going on with them, and someone may actually be able to help them. And in some cases, it may be as simple as using, especially if that individual is doing dance or is a part of the arts or involved in any sports, which most children are, using, those skills to kind of help them to deal with whatever it is that they're going on. But in some cases, children need more than that. They need to get in front of a professional that they can talk to and that can help them to work through the challenges. Because many times, especially for me, working with children and teens, they may tell me things that they haven't told their parents. And as a professional, and because of my ethics, I can't go to their parents and say, hey, this is going on. Now, if, of course, if there's a threat to their safety or the safety of others, I would say something. But I just think that's something to keep in mind, that teenagers and children may not necessarily say everything that's going on. So it's always important to continue to build those relationships. And even I also talk to parents about the parenting styles. So having a parenting style that makes children feel comfortable. There's a lot of parents out there that are more authoritarian and more whatever I say and because I said it, and you don't give your child an opportunity to feel comfortable in the first place, or an opportunity to come to you when any type of disruption in their life occurs, because all they're thinking in the back of their head is that your reaction based on previous experiences. So just definitely developing more for parents who don't have that approach, developing more of an authoritative style that is warm and supportive, that there are boundaries, there are rules, but children do have an opportunity to voice their opinion and to speak freely. So that's really, you know, the foundation of it all. And there's so many more things to do after that.
Well, and as I'm hearing you, I agree. It sounds so simple, but knowing many adults myself who didn't have that growing up, it seems to be quite a challenge. And then they're dealing with this later on in life as well. Before I kind of go into the adults a little bit, just want to show we have Aka giving a virtual hug here. And then Amber says, greetings from Theta Ida Omega chapter of Alpha Gamma Alpha sorority. I assume you know who that is.
This
Thank
is
you
my
for.
sorority, yes.
Oh, I love it. Thank you for this important discussion, Priscilla. Social distancing during the pandemic can be very isolating for children and adults. What is the best way to stay connected with our loved ones in order to maintain our mental wellness during this difficult time? Do you have any thoughts on that?
Amber, hey, my line sister, thank you for such an important question. Yeah, it's difficult for all of us to social distance. As human beings, we are social by nature. We depend on, like this is, being social and engaging with other humans is sometimes one of the ways that we cope when we're dealing with stress and adversity. So when we have a situation like this health crisis that we're in right now, where we're being told that we have to social distance for our safety, it's hard for all of us because we want to like get together, we want to hug each other and do all of those fun things. But there are ways that we can still remain emotionally connected, even though we're socially distanced. And of course, one of those ways is through video and through phone call. It's not the same. It definitely isn't the same. And I think the thing for most of us is that we want to be heard and we want to be seen. And sometimes, like you go on a Zoom
Yes.
meeting, like sometimes people turn their cameras off, and you don't really know if people are hearing you or tuned in. Versus when you have the face to face, you can actually see people, you see their body language, everything. And that's what I talk about when I go into the whole movement aspect and how it helps with resilience. But I would say, in addition to meeting on video and calling your family members to keep that connection. Also, finding fun ways to deal with this situation. They say when life gives you lemons, make lemonade. So, like, what are some ways that we can connect in a way that feels satisfying and fulfilling for us? Maybe karaoke with your family through Zoom, as opposed to just getting on a Zoom call and, hey, like, how's it going? But just doing things where you have an opportunity to feel like, wow, I really connected with this person, and we just kind of adapt to the situation until we're able to get back to our everyday. And the same for children, doing things like that, like they can call their friends through Zoom and maybe blowing bubbles depending on the age level. Like, doing fun
Yeah.
things that you would do in person, I think definitely makes a huge difference. And yeah, we just
Yeah.
adapt.
I agree. And I actually, I used to own a dance studio. So I did with some of my old students. They were all ages, adults, teens, and kids. And I made up this game on Zoom. It's probably around April, like when the COVID first started. And I had them do where I'd say 3 items that was in the house: peanut butter, bread, and a brush. And everyone left, had to go get it, and the first one back, like you had to show your stuff. And then whoever came back first was like the winner. And it was such a cool experience, like you said, because it was kind of different, kind of unique. Everyone's involved, and like you're moving, and Zoom doesn't have to be, let's just sit here and look at each other and talk about how bad COVID is. Right? We can do something different. So I agree with that. I want to switch to adults for a moment. And I'm curious how or if adults handle stress differently than kids. And is the kind of the technique in getting into resilience for adults different as well?
Different because the developmental level, so by 25 years old, for most people the brain is fully developed, but our brain can change. It's malleable. It can be changed at any point in our lives depending on what happens in our environment, depending on the messages and things that we tell ourselves, our mindset. So for adults, it's different, but in terms of resiliency, I would say it's the same across the lifespan, that you can improve your resiliency at any point.
So I want to pick kind of certain topics that have kind of, I think a lot of us have been through, or some people at some point. The first one, especially I think everybody's gone through it at some point, but certainly during COVID, is not having a job. Whether they lost their job, or they're trying to find something, or their business is struggling because of COVID. And so as an adult, part of your work sometimes is part of your purpose. It's also how you make money. And so mentally, that's really hard to be able to be resilient through that, and to keep applying, what's going on here in our brain. And is there any tips you have for resilience when you're trying to find work and be stable financially?
On this same topic, because during this time people are having a harder time finding a job, as well as jobs that they've worked at for such a long time. They're finding that they're either being laid off or not getting as many hours. So it's happening across the board for so many people. And when we talk about grief, we usually think about grief in terms of losing someone, but there's a level of grief that is associated with losing your job, or especially if your job played a major role in your identity. And for people that are experiencing this, looking for a job right now and having a difficult time, and or maybe not having as many hours, I would definitely say to stay motivated, to maintain a growth mindset, and definitely to feel, because some people may also be receiving some rejections or not getting that opportunity, and that can definitely impact their self-esteem, and they may probably feel like, wow, like maybe I shouldn't apply, or I'm not getting anything, I'm getting so many rejections. But definitely maintaining that growth mindset, and knowing that just because you were not successful in this moment doesn't mean that you're not going to be successful the next day. So I think that's important. Staying organized is another thing to definitely keep in mind. Making Applying for a job, yourself on a schedule, and dedicating a certain amount of time towards looking for a job, a certain amount of time towards updating your resume, a certain amount of time towards updating your cover letter, reaching out to people, following up with employers. And I know that's exhausting. That sounds exhausting for me just explaining it. So definitely tapping into self-care, doing things that you need for yourself throughout your day deliberately. a lot of people think about self-care as something that, oh, I just do that on the weekend or whenever I have time off. But people fail to realize that self-care is every day, whenever you need it. If you need a break, taking that break. If you need to drink water, like Maslow and his hierarchy of needs, he talks about the things that people need for survival. So meeting your basic needs as well as meeting those needs that you need throughout the day.
Yeah.
But yeah, definitely realizing that we can cultivate joy even in the times when it may not be our best. So even when you're looking for a job and you're stressed out, figuring out how to meet those basic needs or how to maintain, you can still find ways to tap into things that make you happy. It's definitely something that you have to do deliberately, and it may not be easy, but once you do it, you realize that you can really activate those happy circuits in your brain.
Yeah, I want to show Sandy said for adults, movement is also important for mental health. Yes, I 100% agree. But what about Priscilla? Like, because I agree, I hear what you're saying, but sometimes there are days where people are just like you said, you're mentally and emotionally exhausted. And you feel like, "Ugh, I'm just like nothing's working or I'm just tired, but then there's also sometimes that feeling of guilt to do self-care because I don't have a job, I shouldn't be resting, I should be doing more. So how do you kind of get out of that type of mindset?
With you saying that, that's definitely true. I hear that all the time. And, a lot of guilt and a lot of feeling like I should be doing this. And it really takes a lot to get out of that mindset because for some people, that mindset started from childhood. It probably started with parents and caregivers kind of putting that guilt on you. And, as adults, we grow up, we get older, but there is still a child within. And that child is manifested in different ways. And sometimes it manifests within ourselves, our mindset, and the things that we say to ourselves as well as to others. But what I would say about that is to get rid of those expectations that you should be doing more. A lot of those expectations that you should be doing more probably came from society. So just kind of not following what society says and doing what is comfortable for you. If you feel like having a day where you don't do anything, take it. If you feel like having a 30-minute break here because you just feel like you need it, take that break. Absolutely.
That's the beauty of being an adult, right? You're like, technically you could do whatever you want. I
So,
want
like I
to,
said, self-care is all the time, whenever
yeah,
you need it.
not just the weekend. I like that. Another thing, and I'm looking at your shirt here, which I assume is part of this. Yes. So Black Lives Matter. I always say it's not something that it's been around forever in a sense, but was really heavy, especially during the pandemic. For people that are ever feeling social discrimination, Black Lives Matter, LGBTQ tend to be, the prime sources of this, unfortunately. I can't talk about that experience, but I've had conversations and I hear the pressure and the disappointment and the fear. When people are feeling that and they feel like, what can I do? This is terrible. Like, what do you say? How do you be resilient when there's kind of this social component going on?
Question. So, trauma comes up in many forms. It could be through sexual abuse, childhood abuse, domestic violence, but trauma also definitely shows up in social injustice. So, racism, sexism, all of those different isms, there is a trauma associated with it because for some people, there's privilege, there's white privilege, and you don't have to think about what it's like to be a Black person. Whereas also with the LGBTQ community, I don't have to think about what it's like to be a part of that community and what it's like to be discriminated against every day when I wake up. But they have to think about that. It's at the forefront of their minds, and it's the same for people of color. And I think that has really come to the forefront of our minds in this year. I mean, it's been around for ages, but 2020 definitely, showcased it in a different way. And dealing with racial trauma, dealing with trauma associated with your sexual orientation is never easy. You can't talk someone out of not feeling what they feel. I think definitely knowing that and letting people know that it's okay to feel whatever feelings that they have associated with that trauma and with that stress. That's number one, to let them know that it's okay, I hear you, because the feelings are real. Like, you can't unfeel what you feel about racism. Like, I can't unfeel that, but how do we adapt and overcome? And I think that's the big part, just kind of being realistic with what's going on and kind of figuring out, how do you adapt and overcome? How do you take care of yourself in the face of adversity, as well as what resources can you tune into? And for some people want to take action and be a part of the movement, and that helps with building resiliency as well. So, being a part of groups, like I said, human beings, we're really social people. We love to feel socially connected. So, joining groups of other people who have experienced the same thing and may have similar feelings, joining groups of people who mobilize for change, that's powerful, and that helps with building resiliency as well, because you feel like you're doing something to help with the issue.
Yeah, I like that as well. I think the other big one that I think has been pretty common during COVID, but again in general, is this idea of loneliness. Whether somebody lives by themselves or they're in a relationship, they feel lonely, or even kids, right? They're on social media, but they feel lonely. Of course, there's extremes where people feel an element of anxiety or depression that's debilitating. And then there are some that are just, just not in this great headspace. Where do you kind of see resilience playing here? What is maybe some of the language that somebody could kind of tell themselves to kind of get out of that feeling of loneliness, especially if it goes to a higher level?
That's a good question. So, there's a huge difference between loneliness and being alone. And I think
Yes.
with loneliness, it's more about the sadness that's associated with being alone. So some people are alone and they're fine with that. They don't necessarily feel lonely, but some people are alone and they do feel that sadness and that depression that's associated with that. And it's common and it's normal to feel that way, because that's a part of our nature as human beings, is to be socially connected. So I definitely feel that, there are ways to kind of still, like I mentioned before, still remain connected to others, still be emotionally connected as well. But at the same time, some people use socializing as a way to cope, and that's common. But also, some people run away from whatever it is they're dealing with by always being around other people, and they're afraid to be by themselves, to be alone with their thoughts and their feelings. And that's when true self-awareness really takes place, is when you have those moments with yourself, you're able to meditate, you're able to think without being influenced by what other people have to say. So I would definitely encourage anyone who is feeling that way to, number one, definitely find ways to connect with your loved ones and stay emotionally connected, but also take the time to really try to be with yourself, because how can you expect other people to enjoy your company if you don't even enjoy your company? So I think it's really important to have the relationship with yourself. That's one of our most important relationships too, is the relationship we have with ourselves, the messages that we send ourselves, the things that we say to ourselves. I would also encourage people to have a mantra. So all of my clients, I encourage them to have a mantra, and it's just a positive affirmation that you tell yourself. And it doesn't have to be something you tell yourself when you're having a hard time. But it could be something that you tell yourself daily. Like I said, creating a ritual. So it could be your daily ritual. As soon as you wake up, you're telling yourself that. And, people have different rituals. People may get up and the first thing that they're doing is praying, or some people like to work out first thing in the, but also finding some time to like talk to yourself, tell yourself positive things about yourself. And also, I would recommend journaling and writing things down, because there is a power in writing things down. A lot of clients that I work with, we do vision boarding, we write things down, and they're finding that they're able to accomplish their goals quicker when they're seeing it in front of them. So taking this time is really important.
Yeah, I hear you kind of saying throughout this whole thing again, really spending time connecting with yourself, whether that's journaling or moving or something, positive talk, mantras. You talked a lot about, again, connecting with community because we are social beings. We might have to adapt in how we do it right now with COVID. But then the other piece is also therapy. And I've used therapy myself. I'm a huge component of therapy. I've interviewed so many therapists, psychologists on this show. And I think there is still, so I always have every person that works in this field talk about this. There's still a stigma around, there's nothing wrong with me, I don't want to go, or how are they going to help? Can you talk a little bit about the value of therapy and why it's something not to be afraid of, but how it can be helpful to somebody?
Great question. I'm so happy that you asked this question, because this is like really like, I feel like one of my life's purpose is to kind of educate people about therapy and to reduce that stigma. So I actually created an organization because I feel so strongly about it. It's called Vibrate Higher and Evolve. So that's what my shirt is. So it says Black Mental Health Matters. So there's a stigma, and this is not to say, of course, that other types of mental health doesn't matter. There's a stigma everywhere in all communities that you can think of. But I noticed that the stigma is a lot more pervasive among communities of color. So just having negative thoughts about going to a therapist, also having barriers to treatment, and those barriers could be structural barriers where they may not necessarily have the money to pay for a therapist, they may not necessarily have the insurance, and if they do have the insurance, they may not find a culturally competent therapist or a therapist that looks like them, if that's what they're looking for, that is able to address their specific problems. So it's like a multitude of different issues that people face when, talking about therapy. But I think the first part of that is to normalize the conversation. And I know for many communities, especially communities of color, it's not a normal thing to talk about mental health and to talk about not feeling well. It's often dismissed. Sometimes people make light of it. And I think we definitely just need to do more as a community to not dismiss these conversations, to bring light to it, to take it very seriously, because that's where it starts. And even like going back to childhood, if your neighbors or other adults in your life are not taking this conversation seriously, you grow up with that mentality that
Yeah.
therapy is not effective, or it's, associated with being weak. But I think we can all benefit from therapy. I think therapy is a wonderful experience. It's life changing, and it's one of those things where if you know, you know. I think 2020 is the year for people to come to therapy if they've never been before. And I definitely foresee that going into 2021, that people are going to have a newfound appreciation for mental health. Because, like I said, the need for psychosocial and mental health support has significantly risen this year. And a lot of people are calling therapist, like therapists are overwhelmed right now. Like if there's anybody that's not having difficulty with a job, it's therapists, because people are really recognizing that they need therapy much more in 2020 than ever. And like I said, it's life changing. You really learn to connect with yourself, to build self awareness, and also to develop coping mechanisms that you can use to apply to issues that come up in the future. So one thing to keep in mind is that there's always going to be problems. Like there's no such thing as a perfect life. Life will always come at you, but the good thing about therapy, teaches you tools that you can use regardless of what comes at you. That you feel confident applying those tools, you feel confident in yourself. And that's the other thing. Some people really struggle with self-esteem issues and not knowing, how to navigate. So with therapy, you definitely learn to, build your self-esteem and to be able to make those decisions. A lot of people think that going to a therapist means that the therapist is giving you advice and telling you how you should live your life, but it's actually not that. The therapist is providing the individual with insight because for everybody walking this earth right now, there are things about yourself that you don't even know. And the therapist is able to pull that out, and people have those aha moments, and that's where you build your resilience and your confidence.
Yes. And like I said, I'm such a huge advocate. So I've been to therapy myself personally, but that I've also interviewed a bunch of different therapists. And for those listening or watching, if you're unsure about therapy, there are so many types of therapy, first of all, and there's so many types of people. Just like you said, if you're looking for someone who specifically works with the trans community, you can find it. If you're looking for someone who's dealt with women who've gone through a divorce, you can find it. If you're looking for someone who's of color, you can find it. Like you said, there's so much of it. So maybe the next question is, where do I find this? How do I research this? What should I be looking up? Do I go through my health insurance? Do I just Google it? What is the best way to kind of find the right type of therapy and therapist for you?
Many different platforms out there where people can search for a therapist. A lot of people just go to Google and type in the type of therapist that they're looking for, but people can actually go to Psychology Today. It's one of the biggest platforms that's utilized for therapists and for people to find a therapist in their area, you can search down um, to the type of therapy that you're looking for. You can search down to the specific background of the therapist. If you're looking for a Black therapist, if you're looking for a therapist that deals with LGBTQ issues, or if it doesn't matter, you can just search, okay, I'm looking for a therapist that deals with trauma or a therapist that deals with anxiety. You can also search by the age level. So a lot of us therapists, we are trained to handle any situation that comes at us, but many of us do have specialty areas and niche areas that we kind of tap into because that allows us to really hone in on our craft and just kind of build up that expertise. So for me, I work specifically with individuals who have experienced trauma, anxiety, depression. So those are the majority of my clients. And of course, within that, they may bring other issues, but that's my specialty area. So for anyone looking for a therapist that is working in a specific area, I highly recommend Psychology Today to just kind of search by the specific needs that you're looking for.
And if people want to follow you, get in touch with you, what is your website or social media so they can learn more?
So my website is priscillajohn.com. So my name is on the screen. So it's just exactly how my name is spelled out on the screen. And I also have Instagram, phenomenal_pre. So they can definitely follow me on there. And my Twitter is the same as well. There's also a Facebook page for my private practice so people can get in touch with me in that way.
And what was the name of the organization that you created as well?
Hire and Evolve. So it's basically an organization that's committed to showing up for communities of color as it pertains to mental health. And the way that this is done is by promoting mental health wellness through mentorship, through education, through the arts. So just kind of, I basically, through my research, I figured out the different things that help people to build resilience. And sometimes people may not necessarily feel that they need therapy, although we can all benefit from it. So I wanted to form something that would kind of incorporate all people, whether they feel that they need therapy or not, as well as children. I know having a mentor is really important. Someone that looks like you, someone that's in the field that you think you want to go into. And then there are some adults who still are not sure what field they want to go into. So just having, that ability to tap into that resource and to find a mentor is definitely something that I thought would be beneficial. And I included the arts because, like we talked about,
Mm-hmm.
movement, dance, even playing instruments, all of those things, vocals, they all relate and they all play a role in our ability to be resilient, and they all play a role in how we feel and in impacting the mood. So definitely incorporating that was, it was necessary. And the education part is major. Like that's probably one of the most important parts of my therapeutic work. Like all of my clients speak the same, they're able to speak the language that I do because I teach them what's going on in their body. I teach them from a cognitive perspective, from a neuroscience perspective. So just having that education and making it available to individuals that are not my clients, definitely important. So my organization will be launching in January. This is actually one of the shirts. We also incorporate fashion because fashion is a way that we connect with people. Just like you saw the shirt and you're like, oh, I see that shirt and it says Black mental health matters. And it's just, it starts conversations. It helps to normalize conversations related to mental health and to make it okay. It really is okay to go to
Mm-hmm.
therapist. Like we don't have an issue when we talk about going to the doctor to check on our physical health, but for some reason for mental health, there's some discomfort there. So definitely working to change that conversation is important for me.
Yeah, I agree. And Andrea said psychology today. Great gem. Thank you. And we also have one more question. How does one know what type of therapy they should seek given there's so many different types?
Hey, my recruiter. Hey. I'm also in the army, by the way. So,
Can I just say side note, don't you do something with desserts also?
oh, yes, I do. I have pre-delights, chocolate covered strawberries, and all types of fruits.
I
I
love it.
am,
You're just like a party, Priscilla. I like it.
yes, I am the vibe. Oh my goodness. Yes. So, I'm sorry. The
So the
question.
question was, how do you know what type of therapy to seek? So a lot of times somebody might be feeling like not great and they don't really know like what it is. So how do they kind of find what type of therapist or therapy they should seek? Because we were talking about there's a variety of therapies.
A really good question. People sometimes don't know what they need, especially if it's their first time. And when someone is reaching out to therapists, usually the therapist is asking them questions about their symptoms, what they're feeling, how long they've been feeling it, and just kind of gaining that information. The therapist may be able to point them in the right direction. But I find with a lot of my clients, they are out here doing research before they come to me, and they're telling me what's going on and I've looked up this. So I find that a lot of people, we're in the age of technology and people do have a connection with themselves and they are able to kind of Google what they think may be going on. So when they actually connect with that therapist, the therapist is able to point them in the right direction and kind of just, see what those symptoms may be related to, if it's anxiety, if it's depression, if it's related to trauma. I've had people reach out to me for symptoms of psychosis, a break from reality. And when I really assessed, realized that it was more related to trauma. So it's definitely something that the therapist would help, but the individual can definitely start off with just doing a search based on the symptoms that are coming up.
Yeah, I will also say, because when I was looking for my therapist, excuse me, sometimes you can also be like, if it matters if it's male or female, if it matters the location, like sometimes you can also get, like you said, a vibe from somebody's picture or bio. And so you can kind of look at it that way as well. We have one other question here. What should you expect from your first visit? That's a good question.
Good question. Hey, Ricky. So, From your first visit, usually you're not starting therapy on that first visit. So you're usually doing an intake. It's something that we refer to as a psychosocial assessment. So that's basically getting an assessment of an individual's entire history. So that's starting from their childhood all the way into their adulthood. We're looking at if there's a past history of mental health conditions, if they've been to a therapist before, if they've had any struggles in school, academically, if they've had any behavioral challenges, also looking at what symptoms are coming up for them now, what brought them to therapy, because a lot of the times, usually people are going to therapy when they've hit a rock bottom. There are some cases where people go to therapy just because they just want to improve themselves, but a lot of people are coming to therapy because they've hit their rock bottom and their ability to cope exceeds what they're able to offer at the time. So, yeah, definitely the psychosocial assessment will be the first thing in the first session. And then the next session, it depends. Every therapist works differently. The next session will probably go into the treatment plan where the individual creates goals around therapy, what they would like to
Yeah.
accomplish, and how.
And I think, correct me if I'm wrong, because I think the other piece is too, like, it's common for you to have like a first conversation with them, right? And decide if it's a good fit, right?
First step, actually. That's before you even come to a session.
Yes.
So I provide free 15-minute phone consultations because, I just feel like it's fair for someone to assess if I'm a good fit for them, as well as I'm also assessing if they're a good fit for me. Because, like I said, I work primarily with individuals that have symptoms of traumatic stress as well as anxiety, depression, and anything within that area. So if someone comes to me for something completely unrelated, I want to make sure that I'm able to help them in the right way. And like I said, I can work with anyone, but I really try to stick to my niche.
Yeah, and the other thing I want to ask too, because I did a lot of research on mine, but I know a lot of people who've been to a therapist one time, they had a bad experience. They were like, I don't want to go anymore. And I always say, I'm like, well, therapists are like doctors or haircutters. You kind of got to find the right fit for you. You know, not everyone's going to be a good fit. So, how long would you say somebody should be doing a session with any type of therapist before they feel like it is working or it is a good fit or it's not, and they should see somebody else?
We can't say. It really depends on the individual. I do have clients that call me and say, "Hey, I'm already with the therapist, but we're not connecting. I read your bio or I looked at your profile and I really like what you have to say." Or maybe after the 15-minute consultation, they're like, "Oh, I want you as a therapist." And I do encourage clients to shop around. I don't try to like tell people like, "Oh, you have to come to me," because I may be good for one person, but I may not necessarily be the type of therapist that everybody needs because I do have a particular way of, handling my clients. And I'm more about teaching people to connect with themselves, to evolve into the best versions of themselves, as well as teaching them the coping tools that they need, as well as teaching them to, dive into the root of their issues, whereas there may be some therapists that are mostly cognitive behavioral therapists, and that's teaching people to change the way that you behave by changing the thought process. And I utilize that approach with clients, but that's not the only approach. There is no one size fits all. Every single person on this earth is different. So all of my treatment plans for all of my therapist clients look completely different. So, someone may have the same diagnosis and it may be related to the same conditions, but their treatment plan is going to look completely different because those are two different individuals, two different types of personalities. So I have to really tailor the approach for each person that I'm dealing with. For anyone that's looking for a therapist, I would definitely recommend calling a couple of therapists and following your intuition. We all have that intuition, that gut feeling, if someone's a good fit for you. So just kind of going with that. Signs of a good therapist. Your therapist is listening to you and connecting with you. You actually feel that your therapist is able to help you to work through your problems. So some people have stated to me that they felt that their therapist wasn't listening or wasn't giving them, some people want more dialogue, and some therapists can be a little bit more neutral. I'm neutral, but at the same time, I'm really honest with, I'm transparent, and a lot of people appreciate that. So just speak to different therapists and follow your instinct.
And
Whatever
I
your
just
instinct
want
tells
to,
you, go with
yeah,
it.
100%, just like everything else. The other thing I
Yeah.
just want to clarify, because you're saying treatment plan, and I want you to kind of clarify this, that therapy does not necessarily mean medication, and in most times it doesn't at all.
Therapy does not necessarily mean medication, and that's a good point. It's good to clarify that because I don't want to scare anyone to feel like, oh, treatment plan, does that
Yeah, no.
include medication? I was talking earlier about Bessel van der Kolk, and he's a psychiatrist and he's a top leader in the field of trauma, working with individuals who have trauma as well as doing the research. And he found that prescribing medication in a lot of cases was not as significant as prescribing other things like yoga and out there. So for those, who are interested, there are many studies that are showing that you can actually improve your mood, you can improve your symptoms through different practices, and you may not necessarily need that medication. And even with individuals that are on medication, the medication is not going to work by itself. Medication is basically altering those chemicals in your brain that affect your mood. But if you don't even know why you feel that way and you're not connected with yourself, how are you really going to improve? How are you going to be able to handle stress and adversity that comes up in the future if you're just dependent on the medication kind of stabilizing those chemicals?
Yeah, I agree. I just want to put your Instagram in here again. So if you want to connect with her, I'm putting it. It's PHENOMENAL_PRE, right? Phenomenal Pre, I think it's got. So that's
Yeah.
her on Instagram if you want to follow her. As you can see, Priscilla's just got this great calm energy too, which is so nice to have from someone who's in this field as well. So I would definitely follow her there. And like she gave her information earlier, but Priscilla, this has been so enlightening, I think, for all of us. And I appreciate you being here so much.
For having me. I really appreciate it. And I also wanted to say congratulations on the anniversary of your podcast. I did see that.
Thank you. Yeah, we've had this
Yeah.
for 6 years, over 500 episodes. And again, the show's Ordinary People Doing Extraordinary Things. It's on audio and video. And the whole concept is similar to what you said. Let's highlight great people. Let's talk to experts and figure out how we can improve our mental and emotional well being. So I'm so grateful that you're a part of this show as well. So thank you so much.
We'll be chatting soon. Have a good night.
Yes.